Hi, this is Dr. Tim Conley at Yeshiva University, and I'm going to provide a little bit of a lecture on the pharmacology abuse of stimulants with some implications for clinical practice. The for this particular course that I'm teaching, I don't feel the book chapter does a good enough job of describing just how addictive and how devastating on an individual's life the abuse of stimulant drugs can be. Couple of basics. We talk about stimulants. They are a class of drugs that enhance activity in the central and sympathetic peripheral nervous systems. They crank you up, is another way to put it. They're uppers. They will provide a highly stimulating effect. They affect primarily norepinephrine and dopamine in the brain. Substances included in the stimulant class it covers both naturally occurring plant alkaloids, cocaine, the most famous. It grows as a leaf plant. It's native to South America. It's been chewed and used as part of the culture down there for a long time. Western science came along and concentrated the alkaloids in the plant, reduced them, condensed them. You get a powdery substance when you dry it out, and it's cocaine. You can further refine that into a smokable powder that's called crack. You can render it liquid to inject it. So cocaine had been around for a while. But there are, there's ephedra and cat, and then, very important, more than a dozen synthetic compounds. There are a lot of different little pills out there that are your uppers and your stimulants. Caffeine, by the way, is a stimulant. It's the most widely used stimulant. It actually gets its own chapter in the book because it's just that popular. It is the most widely used substance, mood-altering substance on the planet, actually. If you take a look at prescription synthetic stimulants, you'll see that they're often misused for non-medical purposes. It's why, they're a drug of abuse, and you can develop a substance use disorder. If you look in the Diagnostic Statistical Manual 5th edition, it lists stimulants and what stimulants use disorder looks like. Adolescents will often misuse Adderall and other ADHD medications, etc. And young adults, it doesn't tend to be an older person kind of thing. If you're working with a younger population, you're not sure what somebody's on, you want to see if they're using stimulants. The most deadly one that gets a lot of press, is methamphetamine. It's manufactured illicitly in an uncontrolled laboratory type environment, so it can include a lot of different ugly little things in it as well. You can crystallize meth. It becomes crystal meth or ice. It can be used intranasally, smoked. It's similar to cocaine, but it's a different type of effect. Highly, highly addictive because you develop tolerance to it very quickly. Using a small amount won't work for long. You'll have to use more or just stop using it and start over. There are oral stimulants, prescription and over-the-counter, that are used in work, school, military, sports. People like them because they make them more alert. They're an anti-fatigue medication. They can be abused by college students. And they will suppress sleep and enhance performance. What goes up must come down, and songs have been written. The going up's not worth the coming down. Because the effects wear off, and then back comes the fatigue, back comes the irritability, you'll want to sleep, but perhaps not want to. And after a while of sleep deprivation, you get really a kind of a sleep-induced psychotic state, and you can begin to develop paranoia, et cetera, et cetera. So stimulants, stay on them for a long time, stop, see what happens. You think you'd fall asleep, it really kind of raises heck with that whole system. All stimulants have a potential for misuse and addiction. It varies only by their potency. Cocaine, amphetamine, methamphetamine, very, very high addiction potential, and a very devastating effect on the life of the user as well. Um, Continued use can result or is associated with agitation, aggressive behavior. We present a case study in the addictions courses of exactly this kind of thing, of an individual becoming agitated, disoriented, paranoid. You can have a stimulant-induced psychotic disorder, very well reflected in the psychological, diagnostic manual. Stimulants will often be used in combination with other drugs, but most often with other stimulants, or a person will concurrently use a stimulant and an opioid, sometimes injecting the same kind of thing. So it's a matter of what kind of high a person is getting. You can combine cocaine and heroin, all of which has an amazing instant reward effect on the brain, especially if it's smoked or injected. We know that's the quickest way to get something in. Um, it goes right to the brain. The euphoric effect is instant, and it is very hooking, very easy to get hooked and dependent on these really quickly. Be aware of the over-the-counter stimulants, and be aware of misuse of what are prescription medications with these. So that's a brief lecture on stimulants. Be sure and read your text thoroughly about these, and become familiar with the diagnostic criteria for stimulant use disorder. I think if I had a parting thought on this, it is that the devastating effect that the stimulant has on a person is they're very hard to come off of. If an individual has been on cocaine for a long time, it takes a while for those neurotransmitter systems to right themselves, and not 30 days, but months. You've been messing around with the norepinephrine and particularly the dopamine system in your brain. Dopamine is involved in many, many brain processes, very active in the the physiology of how the brain is working with different parts of itself. And when you manipulate that dopamine system for a while, and then you stop, it takes months, even 6 months. You'll see a post-acute withdrawal syndrome going on with people who've been on opioids. So be aware of that, and we'll want to work closely with medical professionals when dealing with a long-term stimulant disorder when a person's in withdrawal.